Is the carnivore diet okay? What does a massive influencer doctor think about it on YouTube? I'm Dr. Eric Westman, and welcome back to my channel where I review and debunk nutritional misinformation online. In this video, thank you for sending me ideas of things to look at. We're going to look at a video done by a YouTuber called ZDoggMD. If you haven't heard of ZDogg, you'll see him right here. Be sure to stay till the end where I give my final thoughts on the entire show. Who this person is, and I have to say I first heard of ZDoggMD by a fellow physician where I work, because he has a large following among the younger age group of doctors. So even today, I think doctors get a lot of new information from YouTube, from podcasts, and when recently my colleague, Dr. Yancey, was on a Curbsiders podcast, it's a popular one that young doctors listen to. My nephew, who is a doctor, younger doctor in a different state, finally kind of woke up to the idea of the research that we were doing, and anyway, so the information gets spread to doctors through social media, not just to patients. So ZDogg is known, his name is Zubin Damania. He's a physician and trained at Berkeley, at Stanford, University of California, San Francisco, and has that background as a doctor. Doesn't really seem to have any clinical use of dietary programs and all, but he's kind of changed and is in the forefront of a new healthcare approach in Nevada, actually, now. But still, very talented, got to do lots of spoofs and comedies and parodies through the years. So I wonder what he thinks about a carnivore diet, and he's very influential in the younger doctor age group. I'm hosting a free diabetes lab workshop on April 29. If you have prediabetes or type 2 diabetes, this lab workshop will show you the key lab tests to assess your metabolic health, what you need to look at besides fasting glucose and hemoglobin A1C, what triglycerides are and why they're essential to measure, how a low-carb diet can help to reverse type 2 diabetes. Register now to make sure you don't miss it. I've added the link in the description, or you can go to our website at adaptyourlifeacademy.com.
Hey guys, Tom Heineberg's asking me about the carnivore diet. And look, we've talked about vegan and keto and all this stuff, and I gotta be honest, I have no clue what the carnivore diet is. Tom says it's all you can eat is meat. And Sean Baker and other people, Jordan Peterson, have all talked about this diet on Twitter. So I am gonna work out for you from first principles as a doctor the benefits and risks of a carnivore diet.
So careful, most doctors get no nutrition training, even today, 2024. Even back when I was in training in the 1980s and 90s, doctors, medical schools kind of gave away nutrition to dietitians, best I can tell. The only time I really got nutrition training was in the intensive care unit when we were discussing total parenteral nutrition, or how to feed people if they can't eat. So, but this is a very talented young influencer doctor, and he's coming at it from what his knowledge is.
Okay, no, having done none of the research. You know why? Because the research is all bullshit. Because all nutritional research is garbage.
Hang on, wait a minute. Oh boy, so that's not true. Not all nutritional research is garbage. We did clinical trials, randomized trials, prospective studies with nutritional approaches for over 20 years. Some nutritional research that's observational is hypothesis generating, and I'd have to agree that perhaps that's not a good way to make conclusions. It's not experimental. But actually you can do great nutrition research. So I have to just say I'm not happy with the direction this is going.
Okay, for reasons I've talked about. All right, so this is what I think. You're eating nothing but meat. Already you've put this diet into the category of what we call elimination diets. You've eliminated a lot of food and you're narrowly restricting what you eat to a certain class of macronutrients, which are meat. So what are you getting rid of? I imagine you're getting rid of refined carbohydrates, most carbohydrates for that matter, vegetables, you're getting rid of sugary drinks probably, you're getting rid of processed food, and you're eating nothing but meat, unless you're eating just pure processed meat, which sounds delicious. All right, so carnivore already has an advantage because you've cut out a lot of what the standard American diet is known to be bad for, which are processed, high sugar, high salt, garbage foods. Now you're left with high protein, high fat meat products.
So I totally agree so far that the common diets that are healthy have in common is the absence of the highly processed junk food, we used to call it. It's called sugar and ultra-processed food today. But yeah, so in this regard, that would be a positive thing, I would think, to get rid of all the junk foods.
Now, from first principles, there's some very soft, it's very hard to imply what's actually causing versus just correlated with. So red meats, heme-containing meats have been correlated with higher risks of things like colon cancer. Now, nobody knows if that's actually causing higher rates of colon cancer or if there's some other confounding factors, which we've talked about before. So could it be that you might increase your risk of cancer in an absolute sense? Not that much, right? Now, the other downside is there's no fiber, so you're gonna be like, hella swole, bro. And I don't mean muscle-wise, I'm talking about your colon. And that can go with another risk, which is something called diverticulosis, which are little outpouchings of the colon from high pressure associated with potentially a low-fiber diet. Now, again, we don't know.
So this is interesting because he really doesn't know what he's talking about, but they're common false beliefs that you might have trouble with There's a transition period, no doubt, where you change whatever diet you're changing to. People go to the bathroom less often, and the idea of having fiber, though, it's really not necessary. So you don't see pure carnivore animals eating fiber, or even vegetables for that matter. But it was interesting to hear what he said about colon cancer, because he acknowledged that there might be a risk, but it was association, not causation, and then said it was just association, but then call it a negative thing. No, that's not right. So there is no association, no causation between meat, red meat, and colon cancer. This is an association, not causation, and so you should just take it off the table and not even mention it. The fiber thing, again, you shouldn't mention it because when studies were done, randomized trials of giving fiber to people, it didn't do anything. So again, that's kind of an old, he mentioned that he's coming at it from first principles, meaning I guess the beliefs and attitudes people come to diet as a physician without really knowing the science. I'm sorry to have to say that, but you can't say that's a negative thing if it's just an association.
No, but these are kind of associations, and I'm working this out as a doctor, having seen a lot of patients and kind of understanding basic physiology. So in that case, a carnivore diet, which is all the rage now among people who are like, bro, I don't know why I did that, but I pulled something very painful in my side, Tom Heineber. I'm not even joking, like I'm in spasm right now. So I'm gonna continue talking while I have this spasm. The elimination factor may actually help a lot of people to feel better if they maybe don't tolerate refined carbohydrates that well, or they have some other intolerances in terms of digestion, like beans and things like that with fiber that cause bloating and gas and uncomfort. So maybe they feel better. Combine that with a really powerful placebo effect that goes with food, because food is a religion for a lot of people. For vegans, for keto people, for carnivore diets.
Wait a second. For keto people? What keto people who follow keto diets? Or anyway, it's interesting. I mean, I think probably just for show, thinking that these are not religions. I mean, some are more scientifically based than others. People may feel like they're religious about it, Well, actually, there are some religions that have certain dietary focuses to them. I don't think of a carnivore diet as being one that came out from the Seventh-day Adventist group like the vegan and vegetarian diets did. So I don't think that there's a religious basis for carnivore diets. There's no church of meat that I'm aware of. But if he's talking about religious zeal, well, for sure. If you find a diet that works for you, it's very human nature to spread the news to other people. But, be careful. If you're a patient of mine, you got to wait 3 to 6 months before other people will generally follow to see your results, to make sure that they're durable, that they will last. And then people generally follow. You don't advice that's not solicited. If people don't ask for advice, it's generally not welcome. So wait till they ask what you're doing. But it's too bad that ZDoggMD is conflating the religions that do promote certain dietary approaches based on the religion and ones that have come from more the health benefits, which, as he mentioned, the carnivore diet is an elimination diet. It's a gluten-free diet. It's a sugar-free diet. It's a highly preservative and highly artificial dye-free diet. So people may get benefit from that.
Okay, it's a religion. In fact, for people who love the standard American diet, it's a religion. Don't take my Carl's Jr. Happy Star away. And yes, I know what the Happy Star is because my mom used to get it for me quite a bit when I was considerably fatter. Correlation, causation, you decide. Anyways, that's a real doctor figures out the carnivore diet from first principles. Deal with it, share it, or don't. I'm gonna go eat some meat and then also some vegetables because I like vegetables. All right, guys, we out.
Well, so actually it was kind of a non-committal, lukewarm. It didn't really say carnivore was bad. Acknowledged that it could be good in some circumstances. In fact, Amber O'Hearn, who is a scientist, independent scientist, put together a paper on would a carnivore diet give all of the nutrition that you would need. And, pretty much it would. A human would need. The problem with the carnivore diet, as I see it, is we don't have large or even small randomized trials, or even they don't have to be randomized trials, just following people over time, case series of people. What we have are surveys of people who endorse or self-describe themselves following a carnivore diet, and things look pretty good at that level of evidence, but that's not sufficient. It's nowhere near at the level of evidence of a drug being prescribed for a condition, for example. The carnivore diet does not have the level of evidence that is similar to low-carb, high-fat diets. Although carnivore is a subset of a low-carb diet, there are some differences that people report. And, do you need vegetables? Do you like vegetables? Like ZDoggMD is saying, a low-carb, high-fat diet allows for you to have a small amount of that, and it just adds to the variety. I've heard it both ways, for carnivore being monotonous or being so easy because all you have to do is think about eating one type of food. That's a style thing. It depends on who you are, what you value. Some people couldn't just eat meat-like things. Other people say it just simplifies life. So it depends on your point of view and your perspective. So I'm still, kind of cautiously optimistic about carnivore diets. I've seen it reverse health conditions that doctors can't reverse today, even with medications, but we don't have large clinical studies to show the safety and what percentage of folks will respond. Although because of its low-carb nature, it's a pretty high percentage in terms of reversing diabetes and obesity, which are the two main metabolic things that I see in my office. I hope that's helpful, and check out ZDoggMD. I mean, he's very influential among younger doctors than I, and I think in general he's got a pretty good head on his shoulders in terms of what seems reasonable and not, and he was not coming out totally against the carnivore diet in this video, at least. Well, if you like this, please like, subscribe, and ring the notification bell so you don't miss out on further videos. I have new ones coming out on Wednesdays and Fridays now. Be sure to sign up for my free class on how to look at blood tests. It's coming up on April 29th at 8 p.m. And you can sign up at adaptyourlifeacademy.com. Sign up for the 8 p.m. free class on how to look at your labs. And be sure to sign up even if you can't be on the live, because we will send you the replay afterwards. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell. And check out adaptyourlifeacademy.com.